Assalamu alaikum. So, Suprabhadam to one and all. Nyan yarana parijayamundo? Parijayamundi? Ade. So, I am very glad, and this is the golden opportunity to all of you. By the way, last chair, I am audible to all of you. I am audible to last chair. Right? Last chair like, right. So today, before you all are eagerly waiting to present my paper to you. But before going to that, so we do have the guest. So she came from the, many countries. After passing all many countries, she reached to the Calicut. In that case, we give the respect to her. So, by the way, we have something I need to say related to that. India and Russia and Kazakhstan, 3 countries bilaterally will do have some collaboration today with the evidence of all of you. Chancellor of the Open International University for Complementary Medicine, Professor Dr. Dame Tatiana Mal, who is in front of you. Right. Where is she? Right. Okay. So, you tell in Russia, then I will talk to them. Yeah. Please, you just proceed.
Я приветствую участников Конгресса с принятием решения по подписанию меморандума, предоставленного научно-исследовательским центром алгебры и философии. Научная мысль не стоит на месте, и ученые России, Казахстана объединились в изучении гипотезы алгебры философии. И я рада, что к этому событию, к этому исследованию в науке присоединяется Индия. И участники Конгресса подтверждают свое прогрессивное отношение к науке и в научно-исследовательской деятельности. Я думаю, что 3 страны смогут сделать очень многое, потому что мы привлекаем ученых, молодых ученых 3 стран в исследовании гипотезы алгебры философии. Я поздравляю с этим решением и с подписанием меморандума.
Thank you, Dr. Tatiana Mal. So please be here. Today we were discussing about the bilateral collaboration, as I told you. In fact, Professor told that the KUG Oriental Academy of the Alternative Medicine Sciences Foundation and also the Federation of Acupuncture System of Therapy Board and also the National Kazakhstan Medical University, and also there is a Open International University, how there is a Al-Farabi University. There are the 127 universities are there in Kazakhstan, and among them the medical university called as the National Kazakhstan Medical University, and previously that to be known as a Asfendiarov yes. University, who is the rector, the first rector of the university, started in 1930. In the 19th century it started, but still it's running. But the medical courses related to the MBBS and also the other medical courses will going to run in the Asfendiarov University. And in fact, this is the budget university in Kazakhstan, who also wanted to study MBBS in future. Perhaps you or your children or your future generation but in 30 to 50 lakhs, midway between this range, and people can study the medical degree in Kazakhstan. And also there is a novel medical related to the health authority of the Kazakhstan has been approved that university. And further the national commission, the medical commission, which is located on the New Delhi, but that New Delhi also recognized the Kazakhstan National Medical University. So Madam is the very representing to that university. And also there is a bioplasma research center and is the chief rector for that organization in Kazakhstan. And she is come in front of you in order to do the bilateral collaboration and also memorandum of understanding each other, so that we do have the collaboration. That means the exchange of the ideas, exchange of the knowledge, exchange of the education, exchange of our thought process, exchange of the how the integrity to be taken place midway between the many countries. So there are the three countries we would like to have the collaboration. One to be known as the Republic of India. Give the big round of the applause. The Republic of the India is not that the fast board or the Samiullah or the Umar Gurukul. No. This is for the entire India collaboration, and also the another collaboration to be known as a Kazakhstan collaboration, and the third collaboration to be known as a Russian collaboration. But Russian is the algebra philosophy, because algebra philosophy is related to the mathematics, what we can do for acupuncture. But no doubt in future, inshallah, you all will be the responsible in order to bring the robotic acupuncture in future with the support of the algebra. Algebra is required, biochemistry is required, chemistry is required, physics is required. Only the acupuncture needle, you are inserting the needle, that's not quite enough. What is required? Required is robotic surgery is doing. The hotels you go, the robotic waiters, they are supplying. But here, why can't we do the robotic acupuncture in future? That is our dream. So I request to the Professor Tatiana Mal, in order to do the collaboration so that we have the research. But because I visited few times to the China to understand how the research has been taken place for the acupuncture. Only the one needle you just take it inserting, that's not quite enough. But still we wanted to do something is the machinery base. There is the technology is booming today. IT, that means IT information technology, artificial intelligence, chat GPT, many things. But we are sleeping. So you just take one needle, insert here, okay, you will be all right. No. So we wanted to do something extraordinary level with the collaboration of the Kazakhstan. That's what we wanted to do. Madam is super qualified. So therefore she is giving the authorization to do the collaboration. On the way she came from the Kazakhstan to here, but you people are fortunate. I am not the fortunate. Umar Gurukul team is not the fortunate, but you all are fortunate. So we have dedicated to bring her with a lot of efforts. So therefore now we would like to have in future, once we will have the collaboration, how the Mexico University, Intercultural University of the State of Mexico, I think day before yesterday we have the class, isn't it? So many people were participated. We have the collaboration, that means how the Mexico country, how the traditional practices they do in their country, how we do in our country, how we can do in the Kazakhstan country, how they can do in the Russian country. Moscow is the biggest country in the world. So likewise, we all know in the Sri Lanka also, Madam has got the collaboration. Likewise, the KUG Oriental Academy and also the Federation of Acupuncture System of Therapy Board in the Calicut with all the evidence of you people will do the MOU signature today, and later we will have the exchange of the knowledge, exchange of our ideas, exchange of the education. Most probably in future, perhaps we may go to the Russia, we may go to the Kazakhstan further for the development of the acupuncture. For that's the reason we are doing the collaboration this, and I welcome to all of you. By that is evidence that what you are looking in front of all the dignitaries who are sitting in the audience, on the dais, and we will do the MOU signature today, and then later we will proceed for our scientific paper presentation. Thank you one and all. Please pray for us, bless for us, and the concept will become the success. But Calicut is the place where we are booming. We start the Indian collaboration from the Calicut. This is I think sir told, the motherland of the acupuncture is India. I proud that. Thank you for telling that. But we will take to the other countries as well. No doubt Bodhidharma took now, but now there is the KUG Oriental Academy Tech Kazakhstan. Thank you. That's great.
I speak 5 minutes. Yes. Доктора Сamiullah хорошо знают в Казахстане, в Алматы, в университете имени Асфендиярова. Мы знаем о научной деятельности профессора Samiullah. Его статьи были напечатаны в нашем научном сборнике университета, Казахского университета имени Асфендиярова. Этот сборник я вручила в прошлом году на конгрессе в Шри-Ланка, в Коломбо. Сейчас мы предлагаем доктору Samiullah продолжить свою научную деятельность совместно с учеными Алматы, Казахского университета имени Асфендиярова, кафедра фармация. И сейчас лично от заведующей кафедры университета, Казахского медицинского университета города Алматы Башкаевой Асыл Кинесовны передается приглашение профессору, доктору Samiullah участвовать в совместной научной исследовательской деятельности. Также доктора Samiullah я уже знаю давно как good speaker, good профессор, и приглашаем его участвовать в научно-исследовательской деятельности в научно-исследовательском центре алгебра философии по изучению гипотезы алгебра философии. В эту группу входят ученые Казахстана, ученые России, это Большой Урал, это институты таких городов, как Пермь, Уфа, Челябинск и Екатеринбург. И я с радостью принимаю ваше желание участвовать в этом научно-исследовательском проекте. Профессор Samiullah заверяет, что максимальное свое время будет уделять для изучения этой гипотезы. Я рада, что создается коллектив, авторский коллектив по изучению гипотезы алгебры философии. Передовые умы, научные умы 3 стран – Казахстан, Россия, Индия – будут стоять первыми по изучению этой гипотезы. Причем эта гипотеза, она переворачивает мышление всего научного мира. И я рада, что Конгресс принял решение и подписать меморандум по сотрудничеству. Это прекрасная возможность помочь молодым ученым участвовать в бизнесе, который будет объединять 3 страны: Россия, Казахстан, Индия. И эти ученые, молодые ученые с опытом, спикеры, будут участвовать в продвижении гипотезы, в продвижении этих знаний. И я знаю, что у нас все получится. Спасибо.
So there is one more country, in fact we missed it, the Republic of the Iran and Republic of the India, Republic of the Kazakhstan and also the Russia. 4 countries we got the collaboration now. I think Dr. Mana Pansari Brown, she is here, and definitely we do have the Iranian collaboration. We know, but more than 100 students completed from Tehran, and also there is the other, respective place, cities in Iran. But Tehran is the capital city, but many people has been done the different types of the courses as well. But however, the Mana Sanjari Parisi, she is the doctor who completed the PhD in acupuncture. But however, you will going to listen with her talk as well. But thank you to Professor Tatiana Amal and also Dr. Mana Sanjari Parisi. By the way, I should say to my wife, Anis Fatima, thank you very much. Right. She shouldn't get, anger or furious, right? Thank you. Let me start. Umar sir, with your permission, shall we start the presentation now? And where I can see some kind of the slides, it is possible. So please be stand for a minute. Please be stand for single minute. Give the big round of the applause. Sorry, somebody's phone is fallen. I am really sorry for that. Yeah, I think all the Maulvis, Maulana and also Hazrat, and really all the, irrespective of the community, no religion, but we all are one. There is a unity. Screen evida undi. Oh, evida undi. So please be seated. Only for the refreshment you need to be stand. See, since you are sitting in the morning, but you should go to your mind. Please irikkuga. Aringilum irikkuga. Right. Ningal. Dayavayi. Manoranamayi. Shraddhichu. Nokkanum. Enikilla. Subject. Pinne kettanum. Chari. So, Ningal Manasi, mind, body, full of abundance. ഞാൻ ബംഗളൂരിലിருந்து வந்து നിങ്ങൾക്ക് ஒரு ஃபார்முலா கொடுத்துட்டு போகணும் என்று நான் இங்கே இருக்கிறேன். Right. So with the love of the Umar Gurukul, Shuaib sir and all Junaid sir and also my friend who is that Nisab, so all are really thankful to sir, also Shaukat sir. So really I thankful to all of you. See, coming here is not that to give, he will do something for me, no. But with your love, with your good relationship and affection, I am here to do something to you all. That's the reason I am here. But however, I completed my course in acupuncture in 2002. But still I am the student and I am also, learning till my last breath. So hope everybody understand English. Everybody can understand English, right? So if anything you don't understand, pinne enakku etra languages ariyam? 10 languages ariyam. Pinne ningalukku Malayalathil enakku kurichu ariyam. Pinne kurichu manasila enikku. But enakku manasila illame, but parayirthu kurichu kurai undu. നിങ്ങൾക്ക് വേറെ ഏതാച്ചും ലാംഗ്വേജസ് വേണം തമിഴ് അകരമുകര എഴുത്തെല്ലാം ആദി ഭഗവൻ മുതற்றേ ഉലക് ഊടുതൽ കാമത്തിற்கின்பம் அதற்கின்பம் கூடி முயங்க பெறின் அகர் முன்பு உண்ட உணவு சரித்திரத்தை உண்பானால் உடம்புக்கு மறந்தே தேவையில்லை. So many concepts are there in my mind, but still any other language is required. Please let me know. Tamil, English, Urdu, Arabic, Hindi, Telugu, Kannada, Jainism, right? And also in the Chinese, little I know that. But stepping into the Kazakhstan, stepping into the Spanish, and stepping into the Sinhala, that is Sri Lankan language. 3 languages is there in my mind to learn, and hopefully very soon I am going to learn that also, most probably. But now we are stepping into the one subject that to be known as which is the supercomputer in the world. Come on, guys. I used to tell, which is a supercomputer? It is in your head. It is in your head only is the supercomputer. That to be known as a walnut. If you eat walnut every day, you will become the Albert Einstein. This secret I am telling you. Hope everybody will have. By the way, I'll tell to my wife, give me the walnut to me too, and you too take it. Right? Every day will nourish that. Right? So hopefully that is called as a supercomputer in the world. So that to be known as a brain. The brain, how many kgs of the brain? 1268 grams of the brain. So how many kgs of your head? Tale, etra thookkam undu. So 5 to 6 kgs. So adi holding on the one bone that to be known as the atlas and axis. Ellarum ningalukku kaiyila paper pinne pen irukkanum. Ningal eluthanum. So when I'll tell you something, you just write down. That always is good because this is my 25 years experience, right? So pinne ninga spinal cord, so connecting from the brain, medulla oblongata, and later that is after connecting, the brain is commanding to the spinal cord, the spinal cord is commanding to the all the internal organs in our body, isn't it? So therefore, so when my topic is the neuro acupuncture topic to treat the spinal cord and also internal organ disorders, two concepts you just keep it in the mind and then you can practice in your clinical practice as well. Now I am talking about the traditional Chinese acupuncture and also the modern acupuncture. That means allopathy acupuncture and also the TCM acupuncture. But TCM people are giving all the information, all the masters are here, but they are teaching you. But however, we try to understand something is the modern level of understanding, right? So how the other doctors, they are practicing in USA, National Commission for the Allied Healthcare Profession Act. Yeah, it is there in India that has been recognized acupuncture in the September 26 on 2024. You all know that. But in America, so National Commission for Acupuncture and Oriental Medicine and also Moxibushan Royal College, and they also recognized acupuncture, but not only the TCM, but including the modern acupuncture. But today you will going to learn based on the principles of the modern acupuncture, based on the anatomy and then physiological aspect by using the spinal cord. Right. How many cervical bones are there? Please come on. How many cervical bones? 7 vertebrae are there. How many thoracic vertebrae? 12 vertebrae. How many lumbar vertebrae? 5 vertebrae. How many sacrum vertebrae? 5 sacrum vertebrae. Coccyx are 4, but fused as a one bone, isn't it? So all are from the spinal cord, the brain, the medulla oblongata. The medulla oblongata. So this is connecting to the spinal cord. The spinal cord, so going deeper level through the vertebra column, and then each vertebra midway between that spinal cord is going through that spinal nerves are passing. Spinal nerves are passing, spinal nerves are passing, spinal nerves are passing to the internal organ, spinal nerves are passing to the till the toes. So that is the procedure. That is the inbuilt default Almighty Allah created in that way. So therefore that is functioning in our body regularly. Right. So hopefully for that we would like to see how this spinal cord is connected. Right. So we try to understand this spinal cord. Through that spinal cord there is one function. That function to be known as a autonomic system, autonomic nervous system, that divided into two. One to be known as a sympathetic nervous system and also parasympathetic nervous system. Now sympathetic nervous system, you should know this knowledge, but the sympathetic nervous system and parasympathetic nervous system, remember the para means paramedical, medical paramedical. Paramedical is assisting to the medical. Likewise, sympathetic nervous system is very important. The parasympathetic nervous system supporting to the sympathetic nervous system. Now what exactly between these two differences? But now the sympathetic nervous system connecting to the internal organs. Connecting to internal organs. Parasympathetic nervous system also connecting to the internal organ, but supporting to that. You know, flight and then frightening. That means is the escape and also threatening. This is the concept the ANS is functioning in our body. So that what happened, the parasympathetic nervous system from the sacrum, from the cranial, what we call as a, here is the cervical and then sacrum, to be known as a parasympathetic nervous system. Cervical and sacrum to be known as a parasympathetic nervous system, and then sympathetic nervous system to be known as a T1 to L4. T1 to L4. So that to be known as a sympathetic nervous system. So that is supporting to our internal organs. Then how it is connected? How it is connected? Let me see. So that to be known as a dermatome. You remember, you keep it in the mind. Maybe some students knows that what is dermatome, myotome, sclerotome, synditome, enterotome, epitome. So now you look at about the snake, you look at about the frog, you look at about the anything is the mammals or the insects which is passing on the earth, planet. So that to be known as a, you can understand this to be known as a tomes. Snake also having the segments, vertebra that have, but each vertebra there is a segments divided. How many vertebrae we do have? How many vertebrae? Manasalayi undu? Manasalayi illa? Ethra bones undu back le? Spinal cord. 33 vertebrae undu. So pettanne parayunu. ചോദിക്കരുത് പിന്നെ യോസന പண்றது ഇല്ല പെട്ടെന്ന് ബദൽ ചൊല്ലണം ഉത്തരം പറയണം. So now snakes, and also you can see the skeleton, even fish also having that vertebra. I think these people also can see this, the fish also having the vertebrae, that to be known as a, now that concept I will imitate to the human system, right? Now this is called as a cervical, that's called as a cervical dermatome. Remember, please, all of you write down, then you study at home. No, Samiullah has given the lecture, oh, this is very good lecture, but after that, you know what he said? I think it's gone over my head. It's not gone from here to here, but it's gone from here to this, gone to the sky. No. So what you should do, that should go to here and then go to the stomach and also brain, so that you can recognize that. You write down what is dermatome. Derma means, you know, skin. Derma means skin. Tomes means is the segment, is the branches, right? So that dermatome to be known as a, the single nerve, N-E-R-V-E nerve, the single nerve passes to the skin. That to be known as a dermatome. That means is the skin means is the outer layer of the skin called as a epidermis. Then second, myotome. Myo means muscles. The single nerve which passing to the muscle, that musculature or the skeletal system, that means is the muscular system, that to be known as a myotome. Manasilayi ellarkum? Manasilayi illa? Parayu. ജോറാക്കി ശ്രദ്ധിച്ച് പറയൂ. മനസ്സിലായി എല്ലാവർക്കും? ഇല്ല? യെസ്. സോ പിന്നെ മയോട്ടോം മസിൽസ്, സ്ക്ലീരോട്ടോം അത് ബോനുക്ക് വന്ന് സിംഗിൾ nerve which passes to the bone to be known as a sclerotome. Synditome, that single nerve passing to the tendon. Then epitome, that that nerve passing to the internal organ, that to be known as a epitomes, right? And also single nerve passing to the colon, that also to be known as a epitomes, internal organ. right? Hopefully you try to see. You can see the image over here, right? Then this is called as a dermatome, myotome. You can see here, right? So this is the segment. You can find out in the Google. You just ask to the auntie. Which auntie you will going to ask? Google auntie, right? You just ask to auntie, she will give the answer. Yes, dermatome chart, myotome chart, sclerotome chart, synditome chart, epitome chart. So ningalukku image varum. Pinne nokkittu manasula vechikkanum. Sari. So இது dermatomes. So inge cervical dermatomes. I'll give you one example, then two example, then you have to register. If you don't register, that will be the problem. So ஒரு எல்லாமே கொடுக்கிறதுக்கு மேபி எனக்கு 6 hours தேவைப்படும். 6 hours டைம் இல்லை, குறைச்சி டைம் உண்டு. ஸோ பின்ன நீங்கள் ஒரு எக்ஸாம்பிள், பின்ன அதே எக்ஸாம்பிள் வில் பி பாசிபிள் டு ஆல் தி நர்வ்ஸ். எஸ் ஆர் நோ? நவ் லெட் மீ செக் த C1. The C1, C2, C3, C4, C5, right? A, B, C, D likewise. C1 now, which passing to the top of the head. The single now dermatome passing to the top of the head. So which muscle is it? Mimetic muscle, parietal muscle. So in the case C1, evida undu C1, Atlas axis C1, C2 now. Evida undu posterior hairline. Posterior hairline ku korchu male undu. So that is called as a C1, C2. So C1, C2 will be, C1 is the top of the head, then dermatome, that means skin, then myotome, that's known as a muscle. So mimetic muscles, right? So that muscles ku supply pandrathu C1 myotome. Pinne C1 sclerotome. So ivida bone undu. எந்த bone? Parietal bone உண்டு. அந்த போனுக்கு சப்ளை பண்ண nerve to be known as a sclerotome, right? பின்ன synditome, the muscles will become tendon. So the tendons ivida கூட இல்ல, right? So அப்போ epitome or enterotome means the organ which supplies to the internal organ. Dura matter, arachnoid matter, pia matter. Inside, what is existing? There is a cerebrum. Cerebrum is existing. So cerebrum ke energy flow pogirudhu. Evida C1 now, which passes to the top of the head. This is, I am giving you secret. This you may not get anywhere in the books. So this secret I derived for the last many years, but still I am learning. So that you people are giving the chocolate, that means it's the Calicut Kerala biryani. Eat it now. Eat all of you. You are eating biryani? No biryani afternoon. You eat my biryani. What I am talking is the biryani. You eat. That's enough. That you feel the full of stomach. The coffee, the tea, everything I am giving you. You just take it. But now the top of the head to be known as a C1. Pinne C2 now is this the glabella. C2 to be known as a glabella, that's called as a frontal head. So top of the head is C1. Pinne the glabella to be known as a forehead to be known as a C2. Pinne C3 nerves are related to the eyes and also ear. Pinne evida kannu problem undu, pinne ear problem undu. Ningal evida treatment cheyanum. So C3 now activate cheyanum. Manasilayi? So pinna evida undu C3? So evida C1, C2, C3 keela undu. So pinna C4 will be good for the tooth related problem or the jaw related problem. Pinna C5 is the good for the pharynx and then larynx, voice box, tonsils. Pinna C6 is good for the thyroid. C7 is good for the parathyroid. C1 to C7 ningalukku manasula vekkanum. Manasilayi? C1 to C7 evida undu. Ingilirundu C7 vertebra. All are good for the neck region. From here you will going to treat by using the points on the C1, C2, C3. So pinna evida nangal needle vandu podanum. So எத்தனை tune needles வந்து கீழே போடணும் is the question, isn't it? பின்ன C1 to C7 நீங்கள் 0.5 to 1 tune needle deeper level செய்யணும். பின்ன 1.5 tune எவிட அந்த needle location எவிட உண்டு. Do you know Huato Chiachi? You know Chachi, Chechi. Chachi, you know? Chachi means is the my father's wife, to be known as a Chachi in Urdu. But what Malayathil enna endha parayirudhu Chachikku? My father's brother wife. Endha parayirudhu Malayathil? Chachi. So Chachi manasla irukkanum. எப்போ ட்ரீட்மெண்ட் செய்யணும் சாச்சிக்கு அறிஞ்சிட்டு செய்யணும் சரி. ஸோ நீங்கள் 0.5 tune lateral மனசில் வைக்கணும். 0.5 tune. Even you can see Huato Jiaji, but Huato Jiaji is T1 to L5. பின்ன cervical இல்ல, sacrum இல்ல, coccyx இல்ல, but Professor Samiulla is பரையிறது இப்போ உண்டு. இப்போ Huato Jiaji உண்டு, நீங்கள் மனசுல வைக்கணும் இருக்குது. So that to be known as a 0.5 tune lateral to the lower border of the caudal spinous process of the each vertebra, to be known as the Huato Jiaji. You make it as a Professor Samiullah's Huato Jiaji. Whatever XYZ, or you keep your name Umar Gurukul's Huato Jiaji, or anything is the KUG, Huato Jiaji. So that to be known as a 0.5 to 1 tune needle you insert to the deeper level. Then you stimulate. You stimulate for how many minutes? At least 1 minute. எத்தனை சமயம்? ஒரு நிமிஷம் நீடல்ஸ் வந்து போட்டுட்டு எடுக்கணும். ஸோ பின்ன அந்த நர்வ் ரிலீஸ் ஆகும். The bone related problem, the muscle related problem, or the nerve related problem, or there is the internal organ related problem, but you are successfully treating to that cervical tones. That to be known as a cervical Huato Jiaji. எல்லாருக்கும் மனசுல இது பின்ன நாம் நோக்குவோம். So thoracic region, is it okay? Shall I proceed for thoracic region? The thoracic region to be known as I love this so much because I love that such a beautiful concept I am giving you, that you take and taste it like a biryani. Right, now T1 to T12. T1 to T12. பின்ன நோக்குவோம் இந்த PPT நோக்கிட்டு நீங்கள் thoracic 1 to thoracic 12, T1, T2, T3, T4, T5, T12. So from there to there is a nerve. Which nerve? From the C1, C2, from it starts, that nerve to be known as a VAGUS, vagus nerve, which is the biggest nerve in our body. Come on guys. Which is the biggest nerve? Sciatica nerve. So which is the biggest pula in Kerala? Periyar pula. Which is the biggest pula in India? Ganga pula. Ganga pula is sciatica nerve, and Periyar pula to be known as a vagus nerve, isn't it? So vagus nerve to be known as a, that is one of the biggest cranial nerve that starts from the cervical region, then it goes to the lungs and heart and also trachea and also diaphragm, stomach, spleen, intestine, and it goes till the anus. That to be known as a vagus nerve. But you are treating to the vagus nerve, that to be known as a T1, T2, T3, isn't it? But you know that T1, T2, T3, T4, T5, you know there is a Tashu, Fengmen, Fishu, Pericardium, Shu, Sineshu, Dushu, Keshu. You know T1 to UB11, UB12, UB13, UB14, UB15, treating for the lungs and then heart, isn't it? So that to be known as a UB meridian back shoe points, but korchu ulla undu. Huato giaji evida undu. 0.5 tune lateral. Pinna 1 tune lateral enna undu. 1 tune lateral enna undu. That's called as the foramina vertebra meridian. 1.5 tune UB meridian, 2 tune lateral, that is the motor points of the paraspinalis muscles meridian. Then pin a 3 tune lateral to be known as that is the lateral UB meridian. Ningalukku organic treatment cheyyanum, pin a half tune lateral to the lower border le needle etra deep poganum. Ipo thoracic level le 1 tune to 1.2 tune ulla poganum. So however, for the safer side, ningal for 25 mm needle keela poganum. So pinna stimulation cheyyano etra nimisham? Half an hour, 1 hour, etra samayam cheyyanum? 1 minute cheyyanum. So pricking, you just insert the needle, pricking and then lifting and thrusting, lifting and thrusting, lifting and thrusting, lifting and thrusting. So please give me one needle. I'll try to show you how to do that procedure. So please give me one needle. So with the spirit, you just give it to me. I'll show you that how to do that twirling and twisting, but you should do on the spinal cord, not here, where I'm showing you, not here. But you do it like that, but definitely have the vagus nerve. Vagus nerve is good, then you are really good. Your heart is good, your lung is good, your stomach is good, your metabolism is good, your kidney also is indirectly supporting, your mesenteric nerve also good. So many things that we're going to incorporate it if the vagus nerve is good. So that's the reason T1, T2, T3, T5. Till the T5 you treat for the heart related problem, then there is the pericardium related problem. But evida yenda pakkam cheyanum, adu kuda very important. So ningal prashna vande valadu pakkam, ningal idadu pakkam needle cheyanum. So ningal idadu pakkam prashna, pinne vice versa valadu pakkam cheyanum. So நோக்கிட்டு நீங்கள் எந்த பக்கம் பிரச்சனை உண்டு அந்த பக்கம் நீங்கள் நீடல் பண்ணலாம், பின்ன 2 பக்கம் செய்யலாம், இல்லை ஒரு பக்கம் செய்யலாம். That to opposite, not on the same side. But however, that is only for the cervical. But thoracic region, you just activate, no problem. You just activate on the T1 problem. For example, the heart related problem undu, hirudayam problem undu. நீங்கள் எந்த பக்கம் நீடல் செய்யணும்? So left le vande needle cheyyanum, pinna pericardium problem undu, ningal right side le valadu pakkam needle cheyyanum. Valadu pakkam, idadu pakkam, right and left, it get differs. Pinna ningal T8 varum, T8 thoracic 8 level le, but valadu pakkam needle cheyirudhu pancreas ku, idadu pakkam needle cheyirudhu spleen ku. வலது பக்கம் dermatome, myotome, sclerotome, synditome, enterotome, epitomes for the pancreas that indirectly supporting to from the right side. That's the reason Dr. Wolz told that the pericardium, that is the spleen meridian on the left side, the pancreas meridian on the எந்த பக்கம்? வலது பக்கம். So ஏன் வலது பக்கம் டாக்டர் Wolz பரையிறது? Parayum. Because there is the nerve which passes from the T8, that right side it passes to the pancreas. That's the reason he told the pancreas meridian is on the right side, the spleen meridian, that nerve which passes to the spleen, that is on the left side. That's the reason he told on the left side. Manasalai? இதெல்லாம் சீக்ரெட் உண்டு. எவிட சீக்ரெட் உண்டு? எங்கள் மனசுல சீக்ரெட் உண்டு. இப்போ இங்கே எத்தனை பேர் உட்கார்ந்துட்டு இருக்கிறாங்க, இருக்கிட்டு உண்டு, எல்லாருக்கும் இந்த சீக்ரெட்டை அறியாம் இல்ல பரைய ஜோராக. குட். ஸோ பின்ன நாங்கள் T8 முடிஞ்சது, T8, T9, T10, 11, 12. So of course these all are good for the spleen and then stomach. So liver ku treatment cheyanum. எந்த பக்கம் லிவருக்கு ட்ரீட்மெண்ட் செய்யணும்? பின்ன ரைட் சைடில் லிவருக்கு வந்து T8 T9ல செய்யணும். பின்ன வந்து லெஃப்ட் சைடில் ட்ரீட்மெண்ட் ചെയ്യணும் ஸ்டமக்கு. ലിവർ ഈസ് റൈറ്റ് സൈഡ്. എവിടെ ഉണ്ട് റൈറ്റ് സൈഡ്? ലിവർ ഉണ്ട്. പിന്നെ വെരി ഈസ് സ്റ്റമക്ക് എവിടെ ഉണ്ട്? ഓൺ ദി ലെഫ്റ്റ് സൈഡ് ഉണ്ട്. പിന്നെ ലെഫ്റ്റ് സൈഡിക്ക് നിങ്ങൾ ട്രീറ്റ്മെൻറ്റ് ചെയ്യരുത് സ്റ്റമക്ക് ഓൺ ദി സെയിം വെർട്ടബ്ര. ബട്ട് റൈറ്റ് സൈഡിൽ ട്രീറ്റ്മെൻറ്റ് ചെയ്യുമ്പോൾ അത് ലിവർക്ക് പോകും. ദിസ് ഈസ് ദ സീക്രറ്റ്. This is not the simple secret. It takes me 25 years. But I am giving you biryani. I told you why I say biryani. I love this. You know, love this. Because it's not the simple secret. No medical college will going to teach you. Who will going to give this secret? Umar Gurukul called me. I came here to give you some kind of the secret. But this is something is the hidden secrets. But please I am giving you, accept it. So now in that way we will proceed for the L1, L2, L3, then L1, L2. Remember, L1 is the really good place if you wanted to treat for the adrenal gland. Adrenal gland is the suprarenal gland. You wanted to treat if the adrenocorticotropic hormone is good, the cortisol is good, steroids are good. People may not be required to take any kind of the steroids most of the times. But steroids produced from where? L1 vertebra. You activate L1 vertebra. That steroids will going to release in our body with the support of the gland to be known as the adrenal gland. Now come to the L2. L2 is the lumbar 2 vertebra. Evida unde 2 vertebra? Where end of the ribs. From the end of the ribs you go back the central region. So that is called as the Ming Men. Do you know Ming Men? Ming Men is the root of the life, the gate of the life. So after the birth, embryologically, inside the fetus of the mother womb, it started the reservoir meridians. That meridians called as a EOV. That means extraordinary vessels. That's called as a Renmai, Renmai, Tumai, Inchomai, Yangchomai, Inveimai, Yangveimai. Isn't it? The Chungmai and Thaimai. These are the 8 meridians. So these 8 meridians are connecting where? The gate of the life. That to be known as a Ming Men. So ivida Ming Men undu. In the Ming Men ku ninga activate cheyano. Pinna Ming Men it goes to the upward direction. So especially that area to be known as a renal system area. The kidney related condition, acute problem. Even for few years without doing the dialysis, many patients we are treating by activating these vertebrae. Then pinne L3 vertebra. Innoru maha secret undu. Inna secret L3 la secret undu. So ivida irukra etra jananga above 50 years, 60 years, 70 years old, ningalukku oru prashna undu. Andha kolappam endha kolappam? Prostate gland related problem. Prostate gland etra weight undu? 40 gram undu, 40 cc undu. But adu enlargement aayidum. Prostate gland enlargement aayidum. The PSA prostate specific antigen, but adu kolappam undu, prashna undu. Pinna ningalukku post void pre void urine la prashna undu. Appo andha samayathile ningal use panna vendiya vertebra, that vertebra to be known as a which vertebra? L3 vertebra. Note down. L3 vertebra to be given to the prostate gland for all the males. But Mahila, female related problem, before marriage, after the marriage, there is a infertility. In that condition, the PCOS, PCOD are the ovarian related problem. The ovaries are not synthesizing enough follicles in order to get the pregnancy. In that condition, we have to use the L3 vertebra. You know where is L3 vertebra? Which is existing on the, so below the ribs you can find out, try to find out where is that location. We'll try to show you if the situation permits where exactly on the L3 vertebra. Now manasla irukkanum, inna manasla irukkanum prostate gland problem. So evida treatment cheyanum. L3 vertebra. പിന്നെ പെൺകൾക്ക് ഓവറീസ് പ്രോബ്ലം ഉണ്ട്, എവിടെ ട്രീറ്റ്മെന്റ് ചെയ്യണം? L3 vertebra. So therefore, right side or the left side, bilaterally you just use it. The female you just use it, the female vertebra, L3 vertebra, right and left. Then pinna L4 vertebra, that to be known as a mesenteric artery, that to be treatable for all the intestines. So pinna back pain undu. So prashna, because of the constipation problem undu, motion problem undu, diarrhea undu, dysentery undu, pinna white discharge undu. So இந்த சமயத்தில் நாங்கள் எந்த புள்ளி நோக்கணும்? So L4 vertebra needle செய்யணும். L4 vertebra. So பின்ன நாங்கள் sacrum 1 2 3 4 5 I'll try to cut down. So S1 S2 S3 S4. Now we coming to the in the vertebra sacrum. So which is the holy bone? Holy bone evida undu? Evida undu holy bone? Sacrum la undu. That to be known as a S1, S2, S3, S4. That why holy bone? There is a love symbol. There is a love symbol is there. That's the reason that's called as a holy bone. There is a foramina. Foramina means is the hollow. Space is there. S1, S2, S3, 4. Then S1 to be known as a ureter. S2 to be known as a S2 to be known as a the urinary bladder. S3 to be known as a the S3 to be known as a that to be known as a what we call as a that to be known as a urethra. Then S4 to be known as a the lower tip part of the glans penis. So therefore S1, S2, S3, S4 all the pelvic related problem undu. Ureter le blockage undu, pinne urinary bladder le problem undu, pinne ningalukku urethra le problem undu, or the penile organ le problem undu, atho vagina le problem undu. So ningal treatment cheyanum S1, S2, S3, S4 half tune lateral to that, but that having the great impact to treat for all the pelvic related disorders. எத்தனை நிமிஷம் செய்யணும்? ஒரு நிமிஷம் ஆக்டிவேட் செய்யணும். பின்ன நோக்கிட்டு நான் வந்து பரைறேன். So you just have a look, but sciatica எத்தனை எവിടെ வந்து sciatica போகும்? So L4 to come on, L4 to S3 sciatica now pass agum. Kyphosis, these are the different kinds of the monoamines. I'll finish Umar Gurukul sir, then I'll come to the practical. Is it okay? So I'll finish this and then I'll directly come over there, and I need not to see any PPT anymore later. So now there are the certain hormones will going to release in the body. The pain will going to subside in our body. Then what hormone will going to release in our body? So do you know there is the monoamines? So monoamines is releases some of the points that to be known as a, which is the happy hormone? Dopamine. Which is the love hormone? Oxytocin, isn't it? So and also serotonin. So all are will going to release in our body by activating some of the points, and also the pain relief can be taken place with the support of the opiates. The opiates is the majorly will going to release that hormone to be known as a endorphin, enkephalin. So these are the hormones will going to release in our body. And also acupuncture treatment, you can give the needle by using the Auditorium points. How many minutes? 1 minute you just give. Otherwise you give for the long term also for 30 minutes you can give the stimulation. But the stimulation can be given only the few minutes, but not to be given 30 minutes may not be required. But there is some condition we supposed to give. So like this, once we'll give the stimulation by using the Auditorium points, but you can release the nervous system which is got the stagnation and blockages on the spinal cord. So this is what I told you, the Auditorium points, where the half tune lateral to the lower border of the spinous process of the each vertebra. So thank you one and all, and I am very thankful to the giving the opportunity by the KUG Oriental Academy and also all his team members, and also thank you to the Chancellor, and thank you to my wife Dr. Anis Fatima, and also Brown. I am very thankful to you, but all the dignitaries who are sitting here. But what I should do now? What I should do now? Practical? remove this one, please. You remove this one.
ഇത് സ്ക്രീനിൽ കാണില്ലേ?
ഹലോ.
So this needles to be known as a, we says as a chun kun, but you remember this is the 0.25 and into 25 mm. This needle to be known as a 25 mm. So where we need to apply on the cervical region. So let me start from the C1 to C8. I will show you to treat for the most of the condition for the till the parathyroid gland, till the thyroid gland. பிரச்சனை வந்து வலது பக்கம் பிரச்சனை உண்டு, வலது பக்கம் தலைவேதனை உண்டு, பின்ன எனக்கு ட்ரீட்மெண்ட் செய்யணும் இடது பக்கம். ஸோ C1 எவிட உண்டு. ஸோ திஸ் இஸ் த C7 vertebra. Marker is there. Marker is there. Yes. C7. So C7 is the prominent bone. பின்ன இவிடல் இந்த 3 chun above. 3 chun above, see, hairline is ivida undu, but proper hairline is, this is the proper hairline. So, pinne ivida C1, C2, C3, C4, C5, C6, C7. So, enakku valadu pakkam vedane undi, na vandu idadu pakkam needle cheyyanum. So, the entire 1 chun needle smoothly should goes to the inside of the derma level. So it is connecting towards the spinal cord, you just apply, towards the slightly spinal cord, but you don't touch. Sir, his spinal nerve will going to pinch or his spinal nerve will going to damage. No. When it will going to happen, but some of the places are there, but here 1.25 chun deep, so spinal nerves undu, ipo ivangalukku prashna onnum irukadu, complication irukadu. So pinne S1, S2, S1 I told you top of the head, ivida vedane undu. Pinna ningal vandu cheyyanum right side la thala top of the head la vertex of the head la vedane undu. Ningal ivida treatment cheyyanum. Pinna vandu S cervical 2 vertebra, forehead, forebrain having the problem. Pinna C2 vertebra. Pinna eyes and then ear related problem undu. C3 vertebra. Umar sir, you just apply. C3 vertebra. C3 vertebra. Yes. Pinna C3, C4 vertebra. C4 vertebra for the pharynx and then that is on the tooth related problem. Pinne thyroid and parathyroid problem, C6, C7 thyroid and parathyroid problem can be treatable, right? So now hopefully whenever the T3, that means is the thyrotoxicosis, goiter, hypothyroidism or the hyperthyroidism, no matter, hyper or hypo or the goiter, any related problem, we don't know what is the reason, because many reasons are there. But where you need to needle? On the C7, C6. C6 for the thyroid, C7 for the parathyroid problem can be treatable successfully by activating this point for all the thyroid gland related disorders. Now you come to know, so because C1, C2, C3, do you know there is the ophthalmic nerve, there is the ophthalmic nerve, there is a trigeminal nerve, and also there is a, what are the nerves which is passing to the brain region, all the nerves is stroke related problem, hemiplegia, paraplegia, quadriplegia, tetraplegia, anything the stroke is happen from the posterior region, which we call as the middle communicating artery, middle cerebral artery, which is a circle of the Willis in the brain, which bifurcate all the nerves. So that time need to be activated. All the head related problem, C1, that means is C1, C2, C3, for how many problems? The children, they don't speak. Even that condition which we wanted to see, aphasia, apraxia, there is a language learning having the problem. In that situation, what we should do? Yes, C1, C2 vertebra, C2 vertebra for the frontal head. When the Broca's area is affected, then the vernix area is affected on the brain. I'll tell you one more secret, write down. The Bradman areas of the brain you study. Bradman areas of the brain you study to understand the topography of the brain. How many types of the brain? Come on guys, how many types of the brain? 52 types of the brain to be activated by using this point. Indirectly and directly will be helpful. But however, to get the knowledge, what you should do? You study the 52 different types of the brain. As I told you, Broca's area, vernix area, and also the speech area, all are connected to here. So therefore you can activate this point. And then further we go to the vagus nerve. This nerve also treatable for the vagus nerve. Now I come to the T1, T2, T3, T4. Please you just apply some of the points. So T1, T2, T3. T1 you remember, T1 is called as the Ding Chuan. Ding Chuan is nothing but is soothing asthma. So asthma related problem can be treatable by using the Ding Chuan point, that is the T1, because it's regulating to the vagus nerve. T1, T2, T3, T4, T5 you just read. Yes. No, you be married. Half tune lateral. How to press? You just give the pressure. See? Now you give the pressure, you come to know. So where is the one point is located? See? So ivida two vertebrae undu. Idu two vertebrae. So now evida pass agum. So keela pass agum. Keela, back side. பேக் சைடு கீழே வந்து நர்வ் பாஸ் ஆகும். அப்போ இந்த வெர்டெப்ரா பின்னாடி அதுக்கு மேலே வெர்டெப்ரா, இன் பிட்வீன் ஈச் வெர்டெப்ரா நீங்கள் வந்து டச் செய்யணும். டச் செய்யிட்டு எவிட வந்து ஹாலோ ஸ்பேஸ் உண்டு அவிட நீடல் செய்யணும். ஆன் தி வெர்டெப்ரா நீடல் செய்யக்கூடாது. எவிட நீடல் செய்யணும்? The side of the vertebra, பின்னே hollow below the each vertebra touch செய்யணும். So இது வந்து C7, பின்னே வந்து lower portion, பின்னே வந்து அதுக்கு வந்து lower portion. So towards the spinal cord, towards the spinal cord you just apply. In that way that you are activating to the spinal nerves. Now heart related problem எந்த பக்கம் செய்யணும்? So this is heart related problem. இப்போ நான் treatment செய்யணும் heart related. So you pay me the fees after finishing this. How much you will going to pay me? The Kerala rupees? So 1 lakh you will going to pay me because I am giving the free treatment, right? So right, give me the check, don't give me the cash by the way. So now the left side treat for the heart, but right side should be treatable for what organ? Pericardium. The pericardium is good, then the heart also good. Treat bilaterally, that will be helpful. So that I just treating for the heart together. Right side is the pericardium, left side for the heart. Then come to the lower direction in that way. Then the liver 8, that is the thoracic 8. Thoracic 8 evida undu. Idu vandu, spine of the scapula pit. The scapula ivida end agum. This is the pit of the scapula. Come straight, you just come down, then this to be known as a thoracic 7. Thoracic 7, keela vandu thoracic 8. Thoracic 8 half tune lateral. Right side la enna undu? Right side la pancreas undu, left side la spleen undu. Appo diabetes patients ke treatment cheyanum, endha pakkam cheyanum? Valadu pakkam idadu pakkam? Parayyo. Para. Right side, please give me the needle. So please somebody assist me to give me the needles. So right side to be treatable for the pancreas, for diabetes patient, half tune lateral. Dono Weikuan Xiashu. Weikuan Xiashu is the Chinese name. That 1.5 tune lateral to the lower border of the spinous process of the each vertebra, that is called as a T8 vertebra, is insulin production point. You keep it in the mind. Insulin, diabetes, that to be treatable by using this. You just apply this 2 points you just apply to treat for the diabetes mellitus. Isn't it? Pre and then post, you try to find out, do the research. All of you whoever doing the practice acupuncture, please maintain the lecture and then you just try to find out and do the research. But research to be submitted to the here or maybe international level will publish in the Kozhikode. Whatever you people do, I'll tell to Chancellor to do in Kozhikode and Russia, you are going to publish the paper, inshallah. So now we will see that the T8 is over, then the T9, treatable for the gallbladder, right? Likewise, you just come down 12, then L1, L2, L3, the prostate gland related problem. In the vertebra, prostate gland. The kidney, L1 is the adrenal gland. So you try to find out. You touch and then feel. You all of you touch to vertebrae, ribs you touch and then come down. This is the hollow. The hollow to be known as a lumbar 2 vertebra. This called as a first to fierce line. In the line ke enna say parayirde first to fierce line. You touch and then feel and then come down. Then come to this to be known as a L2 vertebra. So in a L2 vertebra for the L1, adukku superior L1. This is for all the adrenal gland related problem, steroid related conditions, asthma related problem, kidney related problem, then the adrenocorticotropic hormone related problem. Emergency means that's called as the acupuncture adrenergic effect. That effect to be taken place by activating this point. Then the L2 vertebra. Where is the L2 vertebra? Please somebody, any practitioner, you just apply. You apply, no problem. Half tune lateral. So now you just apply. So L2 vertebra to treat for the kidney. Then the navel, I have forgotten about the umbilicus. Umbilicus is connecting to the which vertebra? The center of the navel. Umbilicus is connecting to the which vertebra? T10 vertebra. All are, keep it in the mind. Nipple is connected to which vertebra? T4 vertebra for the breast. The breast le endha oru prashna unde. Matlab birates, the breast imaging, radiating, analyzing data system. Birates 1, 2, 3, 4, 5. Innike pengalukku kuda prashna unde. Before marriage prashna unde. After the marriage kuda prashna unde. Pinna idu edukkanum. And the sandarbhathil you can use the T11, the Tianzang point, and also the T4 point. T4 is good for the breast. T10 is good for the T10 in the problem. Umbilical hernia related problem. Pengalukku prashna undu. Ningal evida cheyyano idu vandu T8, T9, then T10. T10 vertebra ivida vandu bilaterally apply cheyyano for the umbilical hernia related problem. So pinna ningal vandinga adrenal gland, pinna vandu renal system, then further below to this to be known as a L3 vertebra. Manasla vekkanum. So that is L3 is good for the prostate gland related problem. L3 is the good for the prostate gland related problem for the male. And then female what condition? PCOS and PCOD related problem. PCOS and PCOD related problem can be treatable by activating this point. As per the dermatome, myotome, sclerotome, syndytomes, right? Then further you come to the, so L3, then L4. L4 evida undi? Idu nokkanum. இது நோக்கிட்டு ஸ்ட்ரைட்டாக வாங்கணும். பின்ன this to be known as the L4 vertebra. L4 vertebra long gap உண்டு. L2, L3, L4, L5 കുറച്ച് long gap உண்டு. பின்ன ഇവിടെ வந்து L4 vertebra. So L4 vertebra is good point to treat for the intestine related problem. You know Ta Chang Shu. Ta Chang Shu. Ta means is the big, Chang means is the intestine, Shu means is the point. So evida undu adu fourth lumbar vertebra 1.5 tune ladder. Ipo L4 vertebra and the now pass agum mesenteric artery, upper mesenteric artery, lower mesenteric artery. Upper mesenteric artery goes to the small intestine, then lower mesenteric artery manasula vekkanum. Mesenteric artery passing to the which organ? Large intestine. So once you activate this, that artery is reaching to the large intestine. Pinna ivida, this is the second pen only. So this is the first two fierce line. This is the first two fierce line. Pinna idu vandu second two fierce line. This is second two fierce line. So now L4, L5 vertebra. Pinna ivida nokitte S1, S2, S3, S4. This is L5, L5, S1, S2, S3, S4. This is called as a filum terminale, cauda equina, where it ends. The spinal cord starts from the brain and spinal cord. Where it ends, spinal cord. On L2 vertebra, register in your mind. L2 vertebra, its spinal cord is over. Spinal cord is over from here. Over. So, இப்போ bone marrow test செய்யணும். பின்ன இவிட வந்து bone marrow test எடுத்துட்டு லேபுக்கு அனுப்பணும். இவிட வந்து bone marrow. Marrow means inside of the bone. அது எடுத்துட்டு கேன்சர் உண்டு இல்ல. பிள்ளை இவிட நீடல் போடணும். எபிடர்மிக் நீடல், ஹைப்போடர்மிக் நீடல் டீப் போட்டுட்டு அவிட வந்து எடுக்கணும். எசன்ஸ் எடுத்துட்டு லேபுக்கு அனுப்புறோம். இவிட பண்ணும்போது அனஸ்தேசியா ஆகாது. இவிட செய்யும்போது அனஸ்தேசியா, that means இவிட பண்ணும்போது paralysis ஆயிடும். This area from here to this area, that means if the injury ஆகும், car accident ஆகும், accident ஆகும்போது இது break ஆயிடும். இது break ஆயிடுச்சு, பின்ன spinal cord is disconnected. Spinal cord is disconnected. I'll tell you, after the birth, the baby is in the mother's womb, then the baby comes out, then the umbilicus we cut. Once we cut umbilicus, then he connecting to the universe, isn't it? Prana energy, it goes to the child. Before that, the energy is going with the mother's womb. Likewise, if from here to here, if the vertebra has the connection, then the entire body having the connection. If this get cut, that to be known as the transverse myelitis. Transverse myelitis, no treatment. No treatment for the transverse myelitis. So therefore we should be done carefully. But if this area is cut, but it's not much problem, but sensation can get, because the spinal cord get terminated here. All this knowledge should be there. Then you come down, this to be known as a from here to here, this to be known as the L4 vertebra, then L5 vertebra. Then further you come to the S1, S2, S3, 4. This called as a filum terminale or the cauda equina get terminated here. So then you wanted to treat for the urinary bladder related problem. So kidney is connected to the urinary bladder. That is pathway called as a ureter. Keep it in the mind, ureter. S1, this called as a Shanglio, Celio, Chunglio, Sialio, Palio. Pa means 8. 4 points here, 4 point is here. So that to be known as a S1 for the ureter. You just apply the needle. S1 you just foramina. Yeah, you just apply the needle. So half tune lateral to this towards the spinal cord you just apply. Towards the spinal cord you just apply. That is called as a ureter. The kidney stones got struck in the ureter. That time you can use. Then the urinary bladder problem. Urinary bladder is connected to the ovaries, fallopian tubes, or maybe it is related to the vaginal organ, uterus, even for the male for the scrotum related problem, and also the penile related conditions we can use it. But S2 vertebra for the urinary bladder. You just apply urinary bladder. S2 for the urinary bladder. All the male having the problem. all the male, but don't blame me, but few of the males having the problem, that to be known as a male infertility, or the sperm count is not good, the impotency, erectile dysfunction, and also premature ejaculation, the sexual activity is not good, woman is not happy, the man is not happy because of the erectile dysfunction is happening, because women get headache because my husband is not making me happy. So in that case, what we should do? We can do it as a strongly, that to be known as a S2 and then S3. S3 to be known as a cavernosus nerves to be activated for the penile organ. When the peen is having the problem, then what is the vertebra we have to use it? Then S3 vertebra, register in your mind. S3 vertebra to be treatable for all the male related problem and also female related problem, S2 and then S3, because the clit and also there is inside the pelvic organ uterus the endometrium thickness and also anti-Mullerian hormone and prolactin and also progesterone, estrogen need to be regulated. I think Dr. Anis Fatima is the expert, but I am taking her subject, but she is the expert, she will going to explain you. Then S3 vertebra, then S4 vertebra is good point to treat for the urethra. The urine is not passing for the prostate gland related problem, or the urine is not passing because of the kidney malfunction. That time please you just apply the 2 points here, and then you just, anyone having the electrical stimulation? You have the pen stimulation or something? No problem. No, I'll show you. I'll show you how to do the manipulation. I think I'm taking a lot of time. Now I just find up within few minutes how to do the stimulation, twirling and then twisting method. I just applied. I mean, you are. Oh, Amal, you are Amal. So now I just activate to Amal. Pray for him, right? So to give the peace and harmony and health and happiness to him, and he have to get the recovery, and finally you have to give the big round of the applause to him. Now I do the activation. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I do like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I just activate for him for the 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then 3 needles I just activate in one time. 3 needles I just hold it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20. So we just activate. So this is one method, or the twirling and twisting method, or the rotating method. So in that way we just activate to the patient, but make sure to he is happy. So otherwise when the patient is very getting pain, he don't come next time, because we have given lot of pain to him. First time don't do the vigorously treatment. प्यार से करो, अच्छे अंदाज से करो, वल्लतुडन यानी नल्ला मनसोड निंगल ट्रीटमेंट चेयनु. But अवनुक्कु वेदने कूडा उंडे first sitting. So next sitting अवन वंदु सिंधिप्पान पोगनुम इल्ला पिन्ने अवन वरमाट्टान. So that you shouldn't do. So thank you very much, and please somebody you just volunteer, you just remove the needle, and thank you for giving me the opportunity. But this indirectly will be helpful to treating for the internal organ as well. But lot of things is there to talk further still. Other those senior teachers are here, senior scientific paper presentation people will give the opportunity for them to convey this message. So ellarku manasilai etra perku manasilai parai நல்ல கை தூக்கணும். எஸ், நீங்க அமலுக்கு அவசரம், நல்ல கை தட்டணும், நல்ல கை தட்டணும் அமலுக்கு. அமல் நீங்கள் நோக்கணும், நோக்கணும் உங்களுக்காக. ஓ குட், ப்ளீஸ் வெல்கம். தேங்க் யூ வெரி மச்.
യെസ്, പ്രിയ സുഹൃത്തുക്കളെ, നിങ്ങൾ